If you're a man, you've probably wondered about this more than once. Is it healthy to masturbate often? Does it help or harm the prostate? And what happens to ejaculation after prostate surgery? These questions come up constantly in clinics, in private messages, even in quiet conversations among friends. So let's unpack it all clearly, with science and a bit of humor along the way. The prostate is a small gland about the size of a walnut, sitting just below the bladder. Its main job? To produce prostatic fluid, a milky secretion that makes up roughly 1/3 of semen volume. On average, each ejaculation releases about 3 to 5 milliliters of semen. But that volume isn't all from the prostate. Most of it actually comes from the seminal vesicles, while only about 1% comes directly from the testicles, which contribute sperm cells, the passengers, not the transport truck. Prostatic fluid is rich in zinc, citric acid, enzymes, and of course PSA, the prostate-specific antigen that doctors measure in blood tests. You've probably heard of PSA if you've ever had a prostate checkup. Now let's talk about how ejaculation really works. It's a beautifully coordinated process between your prostate, bladder, urethra, and a set of muscles most men don't even know they have. It happens in 2 phases. Phase 1 is called emission. This is when fluids from the prostate and seminal vesicles gather inside the urethra, just behind the internal sphincter. Think of it as loading the rocket. Then comes phase 2, expulsion. The external sphincter relaxes, the perineal muscles contract, and boom, semen is propelled out with force. That's the visible part, but it's all powered by a precise coordination between the nervous system and those pelvic muscles. When diseases like diabetes or neurological disorders interfere with nerve signaling, or after certain prostate surgeries, this coordination can be affected. Don't worry, we'll talk about that part in a minute. First, let's answer a common question. What happens if you go a long time without ejaculating? Is that bad for your health? Scientifically, there's no proof that abstaining causes disease directly, but it can lead to local congestion and discomfort, even inflammation in the prostate area, especially in men prone to chronic prostatitis. Chronic prostatitis is a frustrating, lingering inflammation that can cause pelvic pain and urinary issues. While its causes are complex, involving nerves, inflammation, and stress, low ejaculation frequency might make symptoms worse. In fact, one study back in 1999 found that men with chronic prostatitis improved their symptoms when they ejaculated more often, either through sex or masturbation. So yes, regular maintenance can sometimes help keep things balanced. And here's something few people talk about. Ejaculation can improve sleep quality. A 2023 study in the journal Sleep Disorders found that both men and women who had sexual activity before bed fell asleep faster and slept more deeply. Apparently, relaxation chemicals like oxytocin and prolactin are stronger than any sleeping pill. Now, for the question that every man secretly asks, can frequent ejaculation reduce the risk of prostate cancer? Believe it or not, several large studies suggest yes, possibly. One long-term study followed over 30,000 men for nearly 20 years. Those who ejaculated around 21 times a month or more had a significantly lower risk of developing prostate cancer compared to men who ejaculated fewer than 7 times a month. And it didn't matter whether it was through sex or masturbation. Both counted. That protective effect seems strongest for lower-risk prostate cancers. Another study in 2017, published in the Journal of Urology Oncology, found a similar pattern. Men who ejaculated more frequently in their 30s and 40s had fewer prostate cancer diagnoses later in life, and a 2018 meta-analysis reviewing multiple studies confirmed the trend. So what could explain it? Scientists have a few theories. One is that ejaculation helps flush out potential carcinogens, chemical toxins that can accumulate in the prostate and seminal vesicles. When you empty that system regularly, those compounds don't sit around as long, reducing exposure of prostate cells to damage. Another theory is hormonal balance. Regular sexual activity and ejaculation might help regulate testosterone, DHT, and estrogen levels. keeping cell growth under control. A third idea is that sexual activity boosts immune function, helping the body destroy abnormal cells early. And finally, the rhythmic contractions of the pelvic floor improve blood flow and reduce inflammation, lowering oxidative stress, which also plays a role in cancer prevention. Now, before anyone takes this as a prescription, let's be clear. No doctor is saying you must ejaculate 21 times a month to stay healthy. That's not a medical rule. It's just an observation. Everyone's rhythm is different. Age, mood, health, and let's be honest, free time all matter. There's no target number. The takeaway is simply that regular ejaculation seems to be beneficial, but not mandatory. Now let's get to what happens after prostate surgery, because this confuses a lot of men. Not all prostate surgeries affect sexual function the same way. In benign prostatic hyperplasia, an enlarged prostate that makes urination difficult, the procedure removes the inner overgrown tissue while leaving the outer capsule intact. This declogging surgery often relieves symptoms, but it can cause something called retrograde ejaculation. That means semen goes backward into the bladder instead of out through the tip. You still have orgasm and erection, it just looks different. The fluid mixes with urine and later leaves the body during urination. It's harmless physically, but can be emotionally surprising if no one explains it beforehand. Now, prostate cancer surgery is a different story. In a radical prostatectomy, the entire prostate is removed and the urethra is reconnected directly to the bladder. This is a major surgery. And since the prostate is gone, ejaculation stops completely. Orgasm and sensation can still happen, but there's no semen. Two possible side effects are common: temporary or sometimes lasting urinary leakage and erectile dysfunction, because the nerves for erection run right alongside the prostate. In many cases, surgeons can spare those nerves, especially using robotic techniques, but it depends on the cancer stage and anatomy. So after all this, what's the big picture? There's no guaranteed way to prevent prostate cancer. The smart path is regular checkups, PSA tests, rectal exams, and medical evaluations when you reach middle age. Ejaculating often might help, but it's not a substitute for screening or a healthy lifestyle. Avoid smoking, eat a balanced diet, keep a healthy weight, and stay active. Those habits protect you not just from prostate cancer, but from heart disease, diabetes, and countless other conditions. And one last thing, be skeptical about miracle supplements and viral claims online. There's no magic pill, food, or super vitamin that replaces consistent health habits and proper checkups. So gentlemen, your prostate may be small, but it deserves respect. Take care of it, understand it, and don't fear the subject. Thanks for watching, and if you found this helpful, share it with someone who needs to hear it. Staying informed is the best way to stay healthy.